Hello gentlemen, today we are looking at men's health. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Delito, a family physician with the interest in cancer prevention and also public health. Today we will be talking about prostate cancer. The prostate is a glandular gland that is found below the bladder. If you look at this model, we have the bladder, which is here, and then this is the prostate. It is just below the bladder, and it is in front of, this is the rectum. The prostate is just in front of the rectum. So this gland can be affected mainly by two conditions. One is what we call benign prostatic enlargement, and this usually starts from the middle part of the prostate. This is the urethra, or the passage for the urine. So when this prostate enlarges, it infringes on the urinary stream flow system, and it can cause obstruction of urine. Usually cancer starts from the outside part of the prostate, and so that's why it is easily able to feel it when a doctor puts his finger through the anal orifice, and he can easily detect any abnormalities that is affecting the prostate. So usually 1 in every 8 men is affected by prostate cancer, and usually the cancer is not really aggressive. Though not very aggressive, it is the second commonest cause of death in men. Screening for cancer of the prostate has its ups and downs, and most of the schools of thought think that screening is not necessary unless an individual has indications which may warrant him to be tested for the possibility of having cancer of the prostate. Simply because of what we have said before, that this cancer is very slowly progressive. Many of the people who may have it, it might not affect them in their lifetime. But there are various tests that can be done to show those who develop the aggressive form of the cancer. So what are some of the risk factors for cancer of the prostate? And if you have some of these risk factors, then it is good to have a discussion with your healthcare provider whether you need to screen for the possibility of having cancer of the prostate. So if you have a family history of prostate cancer, if you have a history of a condition called Lynch syndrome, which is also a risk factor for other cancers like breast cancer, then there is need to screen for prostate cancer. If you have excessive body weight, those who are obese, smoking is also a risk factor for cancer of the prostate. Reduced exercise, those who live a sedentary lifestyle. If your country of residence, especially most people of the African descent, they are at higher risk of getting cancer of the prostate. Then as you increase in age, your risk of getting cancer of the prostate also increases. So above the age of 55, you are higher risk for getting cancer of the prostate. So also some particular races, ethnicity is also a common risk factor, and as I've said before, it happens that the incidence of this cancer increases as you age. Commonly, the signs and symptoms of this cancer are not recognized until later in the disease. And if you have the symptoms, they might present like urinary tract symptoms, including increased passing of urine. You may have urination many times. The volume of urine is decreased because of the obstruction, and the passage is narrowed, as we have seen from the model. This passage might be pressed on, and then you may have pain because of the pressure on the urine passageway. Then you may have blood in your urine, a condition that is called hematuria in your urine, which can be easily observable to the patient, or it can be microscopic, whereby only seen in the lab when you test the urine. You may have a stream distraction, whereby you may have difficulty starting urine stream, or you may have, rather than having the normal straight stream, then the urine comes like the rain. Then you may have urinary retention, especially if there is a complete obstruction of the urinary passage. Then you may have a kidney compromise, or what we call acute kidney injury. If this passageway is obstructed, then there is accumulation of urine to the bladder, and then this backflows upward through the ureters, which are passages that are back here, and then this backflow goes back to the kidneys, and the functioning of the kidneys affected. You may have difficulties with sexual performance leading to erectile dysfunction, and you may also have difficulties during the ejaculatory process, which could be accompanied with pain. Of course, if the cancer has gone to the vertebral column, then you may have difficulty controlling urine, you may have difficulties controlling your stool, you may have weakness on the lower limbs, and because of pressure on the nerves, and this could indicate late stages of the disease. So for the diagnosis of this cancer, as I've said, the history is very important. If you have a history of any urinary symptoms, back pains, pain on the lower abdomen, then the doctor will do what we call a physical examination, examine you for the possibility of you retaining urine, and he will also do a digital rectal exam. And when the doctor does the digital rectal exam, he's able to feel and palpate the prostate, which usually in the cancerous situation, the prostate becomes very hard, it is nodular, and it becomes stony hard. This could be a sign that there could be a possibility of cancer. Then the gold standard test is what we call a PSA. The normal levels is up to 4 nanograms. The test can be affected by many other things, like that digital examination. If you have a urinary tract infection to the prostate, and also, so the test is not confirmatory, but it's suggestive, especially if the levels are more than 10, then it's highly suspicious that there is a possibility of you having prostate cancer. The gold standard for diagnosing prostate cancer is biopsy, whereby fine needle is put through either through the perineum or through the rectal region, and the specimens are taken from the prostate. And this leads to what we call, if it is confirmed it is cancer, most of the biopsies that will be done, you'll find that it is more of the benign enlargement of the prostate, which is treatable either surgically or using medication. And when there is diagnosis of prostate cancer, then there is what we call the Gleason scoring. And this is a scoring system which the pathologist tries to define how undifferentiated and how abnormal are the cells of the prostate. And depending on how bad and higher in the scale the score is, the more aggressive the cancer is and the need for more management. Other imaging modalities include an ultrasound, which will show whether the prostate is enlarged, and if there is any enlargement of the ureters, and also there could be also enlargement of parts of the kidney, if especially the urine obstruction has been there for some time. An MRI, which is also very important in helping to define the extent of the spread of the cancer from the prostate to the surrounding tissues. And the spread is usually local, but it can go to the rectum, to the urinary bladder, to the vertebral column, and then from there to the liver, to the lungs, and also to the brain. Other tests that can be done include the blood count to show how your hemoglobin levels are, liver functions, your kidney functioning, to help to assess the level of your functioning of your kidneys. So the treatment modalities that are available for prostate cancer, of course, early in the stage, if the cancer is diagnosed when it is within the prostate itself, then surgery is the mainstay of treatment, where the prostate is removed and possibly the surrounding lymph nodes. But once the cancer has gone beyond the prostate, then there is no surgery has no role, and then radiotherapy comes in. You can use the external beam radiation, or you can use brachytherapy. Then there is hormone therapy. This is where especially the cancer has spread beyond the prostate, and the aim of this hormonal treatment is to deprive the cancer of the hormone testosterone, and this can be done in two main ways. It can be surgical, where there is removal of the testes, and it can also be done medically, especially using some drug that suppress the secretion of testosterone, and this is given as a depot, and the patient is given this in sequences until the PSA level is very crucial in monitoring the response to the treatment. For the cancers that are not responsive to the hormonal deprivation methods, then chemotherapy comes in. And of course, for those where the cancer has metastasized or has spread to all the other parts of the body, then supportive care becomes very important, whereby the individual is supported by helping him to manage the pain. If there is any difficulties with the stool or urine, these are taken care of, and of course exercises and diet to maintain the daily activities of daily living. Here when we are talking about supportive care now, we are not looking at prolonging life, but we are looking at making the life more comfortable, more bearable, so that the individual can be able to live a comfortable life as normal as possible. Thank you very much. Remember to subscribe so that you get more informative content and be able to take care of your own health. Remember, your health is your priority. Thank you for watching.